This is some background information for healthcare professionals to support the headache initiative in schools, which has been led by the Ted Ragg Trust and the Exeter Headache Clinic. The first thing to say is that headache disorders are very impactful in young people. This is the World Health Organization disability ranking, and it puts headache as number 2 in the world in terms of disability in those under 25 years of age. Migraine carries the major burden, although tension type headache is more prevalent, and you can see that the migraine incidence is most common in young people. Boys develop migraine slightly before girls, but there's a big peak in the mid-teens at a time when there are many other challenges to these young people. The problem is quite significant. This is a study we did in 2022 at Westex School. We looked at 1,000 students between the ages of 11 and 15, and you can see that 30% of our population had headache 2 or more times a week. This had gone up quite considerably from when we undertook this study in 2009. We're always worried that there may be something causing the headache, some underlying problem, and these are some of the things we might be looking out for. The list is not exclusive, but we're always concerned about headache that is becoming progressive and continuous, obviously associated neurological signs or symptoms, particularly balance issues, double vision, any signs of raised intracranial pressure, waking at night, headache worse with coughing or straining, and also headache with sudden and unexplained deterioration in school performance may be something we would want to look into in a little bit more detail. Fortunately, problems in children are quite rare with serious pathology. This is a database study we did some time ago in Exeter, and we looked at the presentation of brain tumours when young people present with headache. And these are the figures. We found that for every 10,000 headache presentations to the GP, there will be 3 brain tumours against a background rate of 3 in 100,000 in the community. Interestingly, when the GP made a diagnosis of migraine, we didn't find any subsequent brain tumours. These are the 2 main types of headache that are causing problems in young people. Tension type headache is most prevalent, a featureless headache with variable length. Migraine is the more impactful headache. Approximately 11% of young people, not necessarily on one side. The pain lasts between 1 and 72 hours. Typically, the pain has features with it. 10% of young people will get an aura, usually a visual aura, but other features such as feeling sick or being sick, light, sound, touch, sensitivity, and invariably there will be a family history of migraine. Often both these types of headache will occur. Some young people will get tension type headache, which may develop into a migraine, or they will get tension type headache and migraine at different times. So just to go through some of the features of migraine, about 30% of people will get a warning. We call this a prodrome, something is happening in the brain. Then 10 to 20% of young people will get an aura, a transient neurological phenomena, usually visual. Then the onset of the pain builds up gradually, typically between 1 and 72 hours in young people, slightly shorter in young people indeed. And then some people will get a prodrome, they feel fatigue, washed out, some people feel elated. So migraine is very much more than just a headache. These are the sort of complex interplay of biopsychosocial factors that are occurring in young people. We're particularly aware of the fact that if they don't eat or drink, this is going to cause an increased sensitivity to headache. Poor diet, poor exercise, lifestyle issues are problematic. Obviously, there's a high comorbidity with mental health issues, so stress at home, at school, bullying, school pressures can all feed into the mix. Comorbid mental health is very common. If you have migraine with aura, you have a 4 times risk of having anxiety or depression, and this causes poor sleep, which again feeds back into problematic headache. So the whole thing is a complex, interrelated biopsychosocial mix. If you have migraine, this is underpinned by an inherited genetic disposition, and in females, hormones come into play. People with migraine don't like changes in their environment, and fluctuating hormones in females is a common cause of exacerbating migraine. So how are we going to manage these young people? Well, simple advice can get us a long way. Importantly, they've got to hydrate regularly during the day and not skip meals. This is a common cause of problems in young people, particularly when they skip breakfast. Have to keep everything as constant as possible. Regular sleep patterns, go to bed and get up at the same time. Screen time is a controversial area. The evidence is not yet available on how much problem this is in headache, but clearly within an hour of bedtime this is going to cause sleep issues. General lifestyle advice. Diary can often be useful to identify any triggers, and exercise has been shown to reduce the impact of headache. As we said before, mental health is a common comorbidity and important to address any stressors that are exacerbating the problem. So how are we going to medically manage these two problems? Well, tension type headache, simple painkillers is a useful starting point, but we've got to watch medication overuse headache, as we have to do with migraine. Any painkillers taken on more than 15 days of the month on a regular basis will cause additional problem. Obviously not aspirin for those under 16. And from a preventative perspective, then amitriptyline can be useful in young people. The treatment of migraine from a medical perspective, again, analgesics and non-steroidals, useful starting point. Antiemetics are useful, particularly if there's any evidence of gastric stasis, any nausea, and in particular any vomiting. Sumatriptan nasal spray is licensed for young people at a dose of 10 milligrams, but there's huge amounts of safety data on oral sumatriptan. It's just as with all the preventative agents, the placebo rates in children are so high that it's been very difficult to get statistical significance for licensing authorities, but there's no reason why you can't use sumatriptan oral, and in fact it's in the BNF. From a preventative perspective, then prisotavir, amitriptyline and propranolol can be safely used by general practitioners. In specialist care, we might think about topiramate, not in young females, and flunarizine is a calcium channel blocker that is used by specialists. Again, there is no evidence base to support preventative medication. In fact, what little evidence there is suggests that they're no better than the very high placebo rate that is seen. You just need to watch out for this new group of drugs, the gepants, that are coming on stream. These are oral CGRP antagonists, and trials are currently underway to see if these are effective in the prevention of migraine. So that's just a quick overview of headache and migraine in schools. The important thing is to get a diagnosis, particularly for migraine, because the chances are this is going to be with a young person throughout their life, and the sooner they can get an understanding and a control of the problem, the lesser likelihood it is to be impactful in the rest of their lives.